Visions for the Future, Chapter 25. The objectives include identify past events that have shaped and molded nursing, discuss projections of future events that will affect nursing, identify anticipated changes in healthcare and nursing in the future. Trends that will affect the future of nursing education include changing demographics and increasing diversity, technological explosion, globalization of the world's economy and society, an era of the educated consumer, alternative therapies and genomics, and palliative care. Shift to population-based care with increased complexity of patient care. Cost of healthcare and the challenge of managed care. Impact of health policy and regulation, need for interdisciplinary education for collaborative practice, the nursing shortage, and advances in nursing science and research. Influences on new nursing roles include increasing cultural diversity, reorganization of healthcare, interdisciplinary functions, managed care, creation and dissemination of nursing research knowledge, and the information superhighway. Challenges for nurses include nursing roles are expanding and developing rapidly. Education must be adjusted to keep paces with these changes. Opportunities for nurses must control these changes and become proactive. There's an opportunity for nurses to unite in vision and growth for nursing practice and education. Past events that have affected nursing have been many. The American Nurses Association came out with a position paper in 1965, and the position paper stated that there should be two levels of nurses, one a technological nurse, which would be an ADN degree, and then the professional nurse, which would be a BSN degree. The ADN nurses, associate degree nurses, would be educated at the community college level, while the BSN nurses would be prepared in universities. In 1978, that's when they officially decided on those levels. In 1985, the RN to BSN program and the RN to MSN program came about. There's always been a push for all nurses, entry-level nurses, to have a BSN, and that was one of the main reasons why in 1985 the new programs were developed. In 1995, the ANA reaffirmed its position on nursing education. There were events that promoted nurses' growth and development, the development of the advanced nurse practitioner, the national healthcare reform and managed care, and the shift from curing illness to promoting health and preventing illness they were all events that promoted our growth as a profession. In addition, there were events that indirectly affected nursing, and they included medical advances, cost containment measures, managed care in the United States, public policy, informed consent, and the Patient Self-Determination Act. Social movements that affected nursing included the women's movement. Technological initiatives that affected nursing included the information age with computers and personal digital assistants. Future events that will affect nursing, there are 4 different types: probable, possible, plausible, and preferred. Changes are likely to include consumerism, disarray of managed care, biotechnological innovation, information technology, and a community focus. Computer technology has an effect on health and nursing. All healthcare providers will be required to have knowledge and practice skills in using computers. Virtual computerization of the learning environment. This is already happening. 3-dimensional for lifelike learning. In nursing education, online education and services, telehealth, electronic medical health record, pocket computers, and robotics. All of those things will affect health, care, and nursing. Other future events that will affect nursing is the response to demographic and societal changes, which will create challenges in healthcare delivery, and also the aging of society will affect nursing. The environment will affect nursing, and new scientific frontiers such as brain and human behavior and genome mapping will affect nursing. There will be fewer professional nurses in hospitals and more multi-skilled workers supervised by the professional nurse. Basic care will change as technology takes over. Hospital stays will be shorter, and care will address just acute phase of illness and pain management. Regulatory changes such as national standards for licensing entry will affect nursing, and also regulations of physician and non-physician healthcare providers at the national level will affect nursing. Regulations will now be based on competency. They will be broad to allow for change, definitive to ensure a provider is qualified. Quality control will be a key ingredient in determining universal standards, and states could provide the entry examination. Competency standards, not titles, would drive decisions. Continued medical, surgical, and pharmacological advances. The possibilities include cloning, use of machines for procedures and keeping people alive, medications, medical treatment for chronic conditions and infections, pharmacological advancements which require nurses to expand their knowledge of pharmacology. Ethical dilemmas will escalate with the medical innovations, greater need for understanding of the community. Teaching others how to teach will consume more of the nurse's time. Only continuous learners will keep pace with rapid changes, and there will be more of a focus on wellness and prevention. Past lessons that can help nurses in the future. The healthcare delivery system in the United States is flexible. Changes have occurred with warning. No one entity is in control of the healthcare system, and healthcare providers have made major strides each time the system has changed. Visions of tomorrow include healthcare will be provided mostly in the community. Independent non-physician providers, particularly nurses, will deliver a significant proportion of the nation's primary care. We're already seeing this happening. Nurses will work collaboratively with physicians and other non-physician providers. The new providers will be much more attuned to what the consumer wants. Informed consumers will become more self-directed and assume more responsibility for their health. Access to healthcare and consultation will resemble the market for other services and products. Education for nurses will reflect the changes in healthcare delivery system, and application of new educational technologies will take place. Nursing practice will have a global focus. An important and imperative looming change is the decision on the basic preparation of nurses, which again we are already seeing the push for all our registered nurses to have their BSN.